We are here today to discuss your role in safe medication use and what you can do with your medications. This training was developed by the Health Quality Innovation Network, or HQIN, the Quality Innovation Network quality improvement organization servicing Kansas, Missouri, South Carolina, and Virginia. The Centers for Medicare and Medicaid Services, CMS, funds QIN/QIOs to help local providers and organizations create safer and healthier communities. This program will share with you, a patient or caregiver, what your role can be to support local efforts to improve safe medication use. So let's get started. Today's topics that we will cover: why you need to be involved in medication safety, HQIN and other available resources to help support you, and your role and next steps. Why is medication safety so important? How many of you take prescription and/or over-the-counter medicines? Let's not forget the eye drops. And if you don't take any medication, are you a caregiver or know someone that is? Each of us plays an important part to the way we handle and take our medications. You probably have one of the most important roles. Medications are wonderful when they are used correctly, but they can be dangerous and maybe even kill someone when used incorrectly. It's so important to have everyone playing their role. It is especially important for senior patients to understand and be engaged, or as engaged as possible, in taking their medication safely. What might be some of the challenges? Senior patients are more likely to take their medications incorrectly because maybe it's confusing. They have multiple medical problems, memory challenges, visual and hearing challenges, complicated dosing schedules, and multiple medications. One simple thing you can do is to make a list of all the prescription medications and over-the-counter medications that you or your loved one takes. Don't forget to include vitamins, herbal products, and eye drops. List the name of each item, the strength or amount, how you take it, and why you take it. It can be very helpful for you to review the total picture. Keep that list with you at all times. Take it to your doctor, pharmacy, and hospital visits. Ask questions. You are a critical member of your healthcare team. Find a pharmacist that you are comfortable talking to and develop a relationship with he or she. They are another important part of your healthcare team. This slide has a number of links that can provide great information related to safe use of medications. Here is another resource that provides some suggested questions or items to discuss with your doctor as you prepare for your visits. At a minimum, write down any questions you may have about your medications before you go to an appointment. This can help you to make the most of your time with your doctor. Do you need to include all of the questions on the 4 pages of this resource? No, there are different topics covering prescriptions, medical tests, a new diagnosis, treatment considerations for an illness, surgery, choosing a plan, long-term care, etc. Some of these questions might be able to be answered by a pharmacist or another clinician on your healthcare team. What is shared here is meant to be suggestions, just to get you thinking. However, you do need to do it. It is important for you to jot down the questions ahead of your medical appointments. Do you have diabetes? If so, are you keeping track of what you should be doing to improve and take care of your condition? A link to this template will be below this so that you can download it for use. This can also help you to prepare and remember items to discuss with your doctor or another member of your healthcare team. Are you or someone you know taking blood thinners? Shown on this slide are the names of some of the more common blood thinners, as well as a link to a guide of how to safely use them. What approach should a patient use when taking a blood thinner? Well, of course, the best approach. Be careful, eat right, stick to a routine, and test regularly as directed by your provider. Here are some patient-friendly links that provide great information about safe opioid medication use and disposal. Another big part you play in helping to stop or improve the opioid crisis is to dispose of your unused or expired opioids and narcotics. That also includes your Valium and Xanax. The DEA holds drug take-back days, usually twice a year, in October. Use that as a reminder to get rid of your expired medications. Clean out those medicine cabinets. In between those drug take-back days, you can still dispose of unneeded or expired medication. Don't keep the medication. You have loved ones, friends, people that come into your room or home that don't need to be tempted or have access to them. You have grandchildren that could be harmed. Ask your pharmacist about how best to dispose of unused or expired medications. They can be a great resource for you. Another way or ways to dispose of unused expired medications, mix them with an undesirable substance such as cat litter or coffee grounds. Crush the tablets, empty the capsules, put the mixture into a disposable container such as an empty margarine tub or a Ziploc baggie and put them in the trash. Purchase drug disposal bags and follow instructions. A couple possibilities are pictured below. Use the below link to search for local public disposal location near you. Finally, here are a few tips to summarize the main points of this presentation. Where possible, please be sure to remember these points. Always read the label carefully and take as directed. Sometimes the dose might get changed, and if you don't read each refill bottle carefully, you might not remember the change or miss it. That can lead to early or late refill requests. Do not crush, break, or chew tablets or capsules unless directed by a healthcare provider. Some medicines have a special coating that is needed for your body to better be able to absorb the correct dose. Keep medicines away from children. There are heartbreaking stories from poison prevention phone lines. Don't be one of those statistics. Store your medicines in a safe, secure place, away from heat and sunlight. Keep your medicines away from household cleaning products and/or your pet's medications. You certainly don't want to mix those up. I have had calls where people are panicked because they accidentally took their dog or cat's medicine. Keep your tubes of creams or ointments away from your toothpaste. Using those accidentally as toothpaste does and has happened. Never, ever, ever take someone else's medicine. And last but certainly not least, dispose of unused medications safely and appropriately. So I promised to give you some next steps. What are your next steps? You have such an important role to play with your healthcare team. Make a medication list and discuss any questions you have with your pharmacist or healthcare provider. No question is a bad question. However, an unasked question can be considered to be a gap in your care. HQuinn has a template that you can use to help develop your medicine list. There will be a link below this that you can click on to download the pictured template. Here you can list all your prescriptions and non-prescription drugs, vitamins, and herbs. Don't forget the eye drops. Write in pencil so that details can be erased and/or updated as needed. Bring a copy of this form to every document or hospital visit. Update the form after each medical visit to make sure you have an accurate list. Give a copy of the filled out form to your doctor and anyone else who helps to take care of you. And last, but certainly not least, don't hesitate to contact us at HQuinn. The local state contacts are listed here. In closing, don't forget to make that medication list. If you are watching this on YouTube or Facebook, click the thumbs up or the like button near this video if you are committed to taking action and found the information presented today helpful. Connect with HQuinn for other information and resources. Thank you so much for your time today.